I am Frédérique Penault-Llorca. I am a professor of pathology at the University of Clermont Auvergne in France. As a pathologist, I work in female cancer, so breast and gynae tumors. I'm part of traditional diagnosis for breast cancer, evaluating the biomarkers and everything. And I do research on triple negative breast cancer. Well, we work on tumor microenvironment. We try to understand in the neoadjuvant setting the patients that are going to recur very quickly after the neoadjuvant therapy. By that I mean the patients who are recurring within 12 months. And we do spatial proteomics and single cell transcriptomics, trying to understand the relationships between the tumor and the microenvironment. And we have found different predictors and different common features of those patients with very rapid relapse. So for the challenges for the ER law is to be sure that we don't have a technical problem on the slide. So we need to have controls. It could be normal breast if we have some on the sample, or external controls that we put on the microscopic slide and that receive immunohistochemistry at the same time. Because we are going to look to between 0 and 1 to 9%. In France, it's not a problem because this is the cutoff that we have been using for since the last century, since 1990. So for us, we are very trained to that. But for the pathologists now, it's important to recognize that, because before that they were using 1% cutoff. For the HER2 ultra low, it's another problem. This is a category that is very difficult to observe because it's very low intensity staining. This is something that in our mindset, when we were interpreting HER2 staining, we were not looking at all, because we were only looking at high intensity staining. And then we have to define percentage, because it's the same staining that we have in the ultra low and the 1+. But then we have to decide whether it's less than 11% or 11% or more. So we have to do with percentage, and it could be difficult when we are working at very high magnification. It seems complicated to explain like that, but it's really pathology work. And for us, we had really to change our way of interpretation. But nothing is impossible, and I have been conducting a lot of training for pathologists in my country and in other countries on virtual slides the last year. This is totally applicable in MENA regions, because we are using exactly the same tests that we were using. The only thing that is changing is the way we do the interpretation. And for the interpretation, this is really training, this is education and training. And we can do virtual training, that's what we do now for pathologists, with webinars, with sessions, with digitalized slides, where we send the cases in advance to the pathologists, they do scoring on their computer, and then we have a session together on the computer remotely, and we discuss how we score. So this is totally adaptable, because they were doing HER2 before, but now they have to interpret the low range of intensities.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.